you have a meltdown, then just be present in the moment and have the meltdown.
This is Real Estate Beyond the Sale with Trenton Stokes. Welcome back to Real Estate Beyond the Sale. I'm your host, Trenton Stokes. We often talk about how the neighborhood we choose and the homes we build impact our quality of life. Today's guest is an absolute expert on the connection. He's a national leader in healthcare transformation with over 15 years of driving systematic change. He served as a health equity officer, and he leads innovation and ensures that healthcare is accessible and equitable for all communities. He holds an MBA along with the Chief Health Insurance Executive designation, and his work has been recognized from the highest level, including state advisory appointments and national awards. In fact, he's no stranger to the mic himself, as he's the host of the award-winning Heart of Equity podcast. Most importantly, he's my brother-in-law. Please welcome Pleasant Radford Jr. to the show.
Thank you so much for having me, Trent.
Hey, listen, it's a pleasure of mine to get you on the pod. There's no one I can think more deserving of this topic than you and the wealth of information you have to bring to us. So thank you for joining me, man.
Of course.
Did I mention that you're in Minnesota? So how's the weather up there, man?
It is freezing cold. It is, I believe, in the negative 20s at the moment. And so it's January and February are the coldest months in Minnesota. So you stay in as much as you can to brave the cold,
To survive,
to
exactly. So
survive. Yes.
I tell you. So speaking of zip codes and where you're located at, I did read, and I think we talked about this at one point, but I read somewhere that zip codes are a good predictor of health, more so even than someone's genetic code. I know that you've had the opportunity to study on how historical housing policies in cities like Birmingham and even Minneapolis create health deserts. Can you speak to that a little bit?
Absolutely. I live in Minneapolis, my family and I, and it's similar in some ways to Birmingham and quite different. It's different. I'll share the differences in that when you look at the historical housing policies in Minneapolis, many come to believe that Minneapolis is a progressive city, and so the housing policies should be progressive. In fact, that is not true. When you study the history, you see that there were racial covenants that were placed in the lease, the mortgage of a home that prevented Black families from buying, leasing, or occupying a house in white neighborhoods. And because of that, you don't see a lot of integration between Black families and white families, especially at that time. And then when you do a little more research, you also look into redlining, which was a practice not specific to Minneapolis, definitely across the United States. But redlining also shaped the housing within Minneapolis because they literally drew red lines around undesirable neighborhoods, which at the time were predominantly Black and immigrant neighborhoods, and told lenders do not offer money to these particular neighborhoods because it's a waste of money. And so when you look at the redlining, when you look at the racial covenants, and then you also look at urban renewal, and you look at how different construction projects also destroyed major neighborhoods. For example, in St. Paul, the construction of the I-95, I-94 corridor um, divided up the Rondo neighborhood, a historically Black neighborhood in St. Paul, and you see that urban renewal take place in many, many other areas of the United States. And so the impact that you see in Minneapolis is that you see concentrated poverty in certain areas like North Minneapolis. You don't see a lot of integrated neighborhoods, diverse neighborhoods, because you still see these racial covenants in effect. Although they are no longer enforceable, although we had the Fair Housing Act that made it illegal in 1968, you still see remnants of that. And so that is how housing has shaped up in Minneapolis. Now, when you look at Birmingham, when you think about the Jim Crow laws and the negative impact that that had on Black communities, you also look at the prevalence of the Ku Klux Klan and how they played a role in fear and terror and violence. The nickname Birmingham was because you saw a lot of bombs, of threats, fires in Black houses that were in white neighborhoods. You see that there was terror that was basically pushing Black families from these neighborhoods and segregating these neighborhoods. And so you see different tactics at play in Minneapolis and in Birmingham, but the impact is the same, which is we don't want Black families, we don't want immigrant families in our white neighborhoods. And so you still see these divided neighborhoods as a result. And because of that, that does have an impact on your health, because if you live in a undesirable neighborhood, for example, you might not have the same access to groceries and clinics and hospitals as you do in more desirable neighborhoods. That has a negative impact in terms of your health outcomes, on stress, anxiety, which I can share a little bit more. But you do see that impact, and you see that in the zip codes as well. And
Yeah,
so generally, that's where that's where you see that research.
yeah, that definitely affects expectancy, life expectancy. And that's just sad. But again, that there's the government has their fingerprint on a lot of outcomes and results that we see today in zip codes. I mean, every day I drive by and I see the effects of that when I go to a Woodlawn or a Fairfield. Although they may be up and coming, but you ask the question, what took place here? We try to look at property value. We don't just look at property values. We look at, is there fresh food? If there's safe parks, we have to kind of see ourselves as more than just real estate agents, but as health providers in a way, because we can definitely see how where someone lives, their stress levels can be affected for the next several years. Um,
Absolutely.
so yeah, good stuff, man. Thank you. So we talk a lot of times about stability and home stability. Why is a stable home considered the foundation for mental well-being? I mean, um, does housing instability, is there a correlation between that and chronic stress?
Yeah, there is. When you think about a house, you think of four things: predictability, stability, privacy, and control. And that's what helps monitor or regulate your health, your emotions, your mental health in many ways, because you have that stability, which means that you're not constantly thinking about, well, where am I going to move to next if I'm evicted? Or do I have enough money to cover mortgage? That predictability also helps to calm the stress levels down, because you always know that there is a constant in your life, which in this case is housing. That privacy piece is so important in that it allows you to lower your guard, we'll say, and to feel at home, no pun intended, to feel at home and to be able to, just have some control over your life. And so when you look at housing stability and its impact on health, when you see people who are long-term homeowners, many times one could believe that their health is much better. They have that stability. They're not constantly thinking about, where we're going to move to next. And so that improves your mental health. It lowers those cortisol levels. It allows you to sleep at night. You're not constantly disrupted by, the what ifs in your mind. And also it provides that ease of mind. When you have that housing instability, those questions occur more often of, will I be evicted? Do I have enough to cover rent? If I am evicted, where will I move to next? And so you're at a constant level of stress, of anxiety, possibly depression. And so housing stability is so important for your health and your well-being.
Absolutely. Well, that's good stuff, man. That's good stuff. I totally agree. Shelter is mandatory, and if you the more serene your shelter is, the better you are able to be able to take on. You have more mental capacity, and again, less stress. You mentioned cortisols. You know, the more happy you're in your environment, you lower that cortisol level that we just discussed. So good stuff. Now, let me get to your podcast for just a second. I've had a chance to listen to it, and it's really, really, really good stuff. I think everybody should take a listen to it. It's called The Heart of Equity. What what is the intersection between social equity and healthcare and the equity we talk about that's in real estate? Could you talk about the overlapping interest there?
Absolutely. The Heart of Equity is a podcast where I interview Black healthcare professionals to learn what are they doing to improve health in the Black community. And many times I interview local Black healthcare professionals. I also had the opportunity to interview regional and even national speakers to learn more about what are the problems and what are the solutions and how are they moving those solutions forward. There's also a segment in the podcast where we're talking about how the listeners can be proactive and contribute their time and their money to Black owned businesses so that we're able to build generational wealth. So that's in the nutshell what the podcast is. When you look at the tie between social equity and housing, you see that unfortunately there are many Black people who are not homeowners. And so there's still that large disparity between white and Black homeowners. And because of that, it becomes a stressor in our life because many times we may not have that stability to buy a home, or if we do have that stability, maybe things happen where we lose a job and we don't necessarily have the emergency savings to fall back during that time to stay in that home. And so because of that, we may lose our home sooner than say our white counterparts. And so when you think about the housing stability, you think about the mental health, you think about um, the neighborhoods in which these houses are. All of that plays a role in our health. And when you look at, for example, we'll look at Birmingham, we'll look at Mountain Brook, a wealthy area in Birmingham, Alabama. We're talking about awesome shops, boutique salons, and restaurants, and places where people can walk to and from where they need to go. They don't need to rely on a car or a bus to get to where they are. If you look at the health outcomes in that area compared to, you mentioned, say, Woodlawn or some of the other areas, you do see a gap because that so one of the reasons you see that gap is because you don't see the same access to resources that say a mountain brook has compared to Woodlawn. And so it's important to have that, and it's important, especially within Black communities, that we have access to that. And many times we don't. Either we're priced out of that neighborhood, or we don't feel comfortable because we're the only Black family in that neighborhood. But you do see that tie, and it's important for us to talk about that, and important for us to think about what are ways that we can um, have access to some of these neighborhoods and these houses in these neighborhoods to improve our health over time.
Yeah, you mentioned something you just said about, when you move in, when you integrate certain areas and you're the only one, that can be stressful. In a place that you call peace, so supposed to be peaceful, there's a stress that you really can't handle yourself at that point that you receive from outside those walls by being, the only, blacks in the area, or whatever the case may be. Yeah, this stuff. I never thought about that. Never thought about that. Plus, let me ask you this question here. We deal with a lot of home buyers, prefer, for the most part. Moving is kind of ranked at the top of like one of the five most stressful life events that I hear about and I'm told about. Do you have any advice for maintaining some mental wellness during the buying process or even the selling process for that matter? What would you suggest?
Absolutely. A few tips come to mind. One is it's important to normalize the stress and to name that it is a stressful event in our lives. It's also hopefully a fun time where you're able to move into a dream house and to build it the way that you want. But acknowledging that it is stressful is important, and finding those people you can talk to, the friends in your network who can offer that piece of advice or that ease of mind is important. It's also important to understand that anxiety doesn't necessarily mean that you're making a bad choice per se. Anxiety just may mean that you want to make sure that you're doing everything you need to optimize the choice that you just made. And so that's important to understand. Try to maintain routines as much as you can. It's stressful trying to move all your stuff from one place to another, especially if there's a deadline that you need to meet to move or to sell a home. And so little things like every night I'm going to make sure that I go to bed by say 10 p.m. Or we're going to make sure that every night we have dinner as a family, regardless of where we are, regardless of how much we have on our plate. Having some level of routine can also make it feel as though there's some things that are under your control, while these bigger things may be out of your control or they feel like they're out of your control. It's important to pause. If you just need some time to say, "Hey, I need to pause," or "Hey, could you rephrase that? I didn't understand that." It's okay. And if you say, "Hey, this is not the right decision for me," then talking with someone to just see, well, why is that not the right decision for you? And do we need to pivot, or do we need to slow down the process, or maybe do we need to just get out of the process entirely?
Yeah,
And then the last thing that, and you mentioned this, Trent, that real estate agents play a role in really helping the buyer or seller think about the house, not as just that financial asset, but also that opportunity for you to build a place that you call home or a sanctuary, something that offers you peace. And so, a question that a real estate professional could ask is, will this house, will this asset support my rest, my relaxation, and my peace? You don't want to buy a house that creates anxiety for you. Anxiety in the sense of, hey, I don't know if I'm going to be able to make the mortgage every month. Or, as I mentioned before, I don't feel comfortable in this neighborhood because I'm the only person in this neighborhood. I can't relate. But those are important questions to ask. And if you're able to talk through that with your real estate professional to see, hey, okay, this is helping me, achieve not only financial goals, but also physical and mental and health goals, then that's something that you should do as well.
absolutely. I love that, man. I love that. And I'm always telling my team that outside of being the real estate professional, we're also the consultants. We have to have a holistic approach about the purchase. And again, I think now with having this conversation, we have to include the mental piece aspect of it because not only are we real estate agents, but we need to be looking at it as mental practitioners in terms of trying to mitigate stress if we can. And yeah, I think that's good stuff, man. Thank you for sharing. Any advice for those moving into their homes on day one? Any advice to give them to mitigate stress that day, like a move in to prevent move in meltdowns, as we call them?
If you have a meltdown, then just be present in the moment and have the meltdown. It's okay too. Sometimes you just need a good cry.
Right,
Sometimes you just need to yell or scream, whatever, and that's okay.
right.
Allow yourself that time to do that, and then find out what you need after that. But day one is important. It could be, hey, we're going to We're going to celebrate, whether that's we're going to go out to eat or we're going to make sure that we move in certain parts of the house so that it feels like we're able to, have some traction. Or I want to make sure that I get the TV and internet set up so that I'm able to still stay connected to the world, or, invite my friends to help me move. Whatever it is that you need, just make sure that it creates some sense of control for you, and it helps to ease your stress. And more importantly, it allows you an opportunity to celebrate this momentous occasion that you now are a homeowner. That's amazing.
Yeah, good stuff. So, I'm going back to something you mentioned earlier when we were talking about the name of your podcast and the word equity. Again, it's a double entendre. We have, as a real estate agent, we look at it differently, but then there's also the health perspective of what health and health equity is. In your opinion, how do we bring those two worlds together? For young homeowners, how should they look at that? What should be their perspective when they go out to buy a house? Should they be looking at, does this support my health equity as well as my financial uh, and social equity?
Absolutely, absolutely, and I'm glad you point that out, because even when I talk about the term health equity, many people think of the financial term equity, which is fair. It's a different term, but it uses the same word.
Mhm.
But when you are buying a home, you should think about the financial equity. You want to make sure that this house that you're buying is appreciated in value, because it's an expensive asset. So if you say buy a $400,000 home, and in 10 years time that house is still worth $400,000, that's a concern. You want that asset to grow over time, because you're able to withdraw from that and say, hey, I have an emergency in my life, or I need some extra income to build out a certain area of the house differently, or I want to refinance on the home. Whatever it may be, you want to make sure that that asset is appreciating over time. And so you definitely want to ask that. And generally, that is tied to the neighborhood in which you live. And so, say for instance, if you live in Mountain Brook, your house is going to appreciate in value because of the reasons I mentioned. You have those shops, you have those great schools, you have those manicured lawns, you have places where you can walk back and forth. And so you want to ask those questions financially. Health wise, you also want to ask the question of, am I able to walk in the neighborhood and and feel at ease? I don't feel like I'm threatened. Am I able to go to the store and get access to fresh fruit and vegetables? Am I able to go to the park and play with my kids? Or, if you have pets, am I able to run with my pets? Or is this a place where I can send my kids to school and not necessarily send them out of the district? I can still, stay in the same district. Those are all health equity related questions that are important as well, because you want to make sure that you also feel comfortable, because when you feel comfortable, your body is at ease. Then other areas are able to flourish. You're not always on edge. So you want to ask those questions both financially as well as with your health.
Okay, well, listen, thank you. Pleasant, listen, I know your time is very valuable. I'm going to get you out of here, but we try to do this thing called Beyond the Sale Rapid Fire. I'm going to ask you a few questions, okay?
Okay.
There's no wrong answer, but I want you to think quickly and come up with it. And it's going to be easy. It's not going to be anything too difficult, okay? All right. So the first question I've got for you, what's the one thing you see in a house that makes you say, I don't care how cheap it is. I don't want.
A garage. We have to have a garage in the house, especially in Minnesota, especially in the wintertime.
Oh, yeah, you got to. I can see that being a must. All right. As a health professional, what's the number one rule for a bedroom to make sure you actually get rest in it?
I'd say make sure you have a comfortable bed.
Yeah.
That's the first point. Or that's the most important part of the bedroom is the bed.
Okay. Good answer. Good answer. What's one sign of a neighborhood that tells you this neighborhood is on its way up in terms of community?
The diversity of restaurants.
All right. All right. I like that. Okay. Last question for you. You just signed a 30-year mortgage and you're feeling the weight of it. What's the one thing that you can do in the next 60 seconds to help you calm down?
The first thing to do would be to see if there's ways to lower the monthly payment over the life of the loan, um, through refinancing, if the interest rate is particularly high at the time.
Okay. I like. All right. Well, listen, man, I'm going to let you go, brother. I appreciate you spending time with me and actually coming on, man. I can't thank you enough. Well, you really helped us pull back the curtain on, why our home is so much more than just four walls and a roof. It's really the heartbeat of our mental and physical wellness. Listen, to everyone listening, remember your zip code shouldn't determine your health, and your real estate journey shouldn't cost you your peace of mind. This is exactly why we go beyond the sale. If today's conversation has shifted your perspective, do us a favor, share this episode with one person who needs to hear it. You can find us more resources on wealth, health, and wellness in the world of real estate at Stokes and Co Realty, and you can find us on all of our socials. Pleasant, is there anything you want to tell them where they can find you at?
You can find me on LinkedIn. You can also search for my Heart of Equity podcast on all major platforms.
All right, good stuff. Until the next episode, peace.
Take care.